Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stefanie Christian. Today we're going to talk about my favorite way of treating the double chin. At some stage, most men and women don't like how their necks look, especially in these days of selfies and social media, when we have pictures taken at strange angles or new angles, and they're saved forever, often out of our control. So why do these changes in the neck happen? Well, for one thing, we lose collagen and elastin. And although many of us who are in our late 50s or early 60s or 70s didn't have sunscreen as we were growing up, once we found the religion about sunscreen, we used it on our face, but we forgot what frames the face. So it took us a long time to learn to use sunscreen on our necks and chest, and the neck and chest frames the face. But if we spent any time at pools or on boats or at beaches, you get 85% of reflection off of those surfaces, and that is going to hit the neck, especially under the chin. So you have an accelerated loss of collagen and elastin right up here. And that leads to the turkey waddle, this little flap of loose skin and fat that bothers so many people because they no longer have that nice cervical mental angle here, or the dreaded double chin, or a diffuse fat layer and some sagging that brings people into my office saying, what can you do about this? Well, the Precision TX is a terrific technology of micro laser liposuction and tissue tightening. It's an outpatient procedure that has less downtime than its competitive surgical procedures. It's minimally invasive, it's fast, and it's effective with a very high patient satisfaction rating. In under 60 minutes, you'll get a better angle in the cervical mental area. So cervical because it's the cervical spine, and the mentum, again, the chin. And depending on what has to be done, what the challenges are, if there's also fat and a problem with the angle of the jaw, then we'll need to do a more extensive procedure. And you can also get an improvement in the angle here. And along with that, you'll get tissue tightening. So how does the procedure work? Well, there are the various extents of this procedure. The minimum one is just one incision here, and that's if there's just fat and a little bit of saggy skin in the middle. If there's fat all along the neck, then we do one incision here, and one incision here, and we do micro laser liposuction and tissue tightening all along the neck. If there's fat all along the neck and there's some sagging here so that you've lost some of your jawline, then we also do some tissue tightening up in the cheeks. We never do liposuction up in the cheeks because we lose a tablespoon of fat in the face every year. So you never want to actually take fat out of the face. So we do this under oral sedation and local anesthetic. And that numbs whatever area that we're planning on working in, but it also does something else. It separates the skin from the underlying tissue, and it gives me a plane in which to put the laser. That's right. The laser goes under the skin right into the fat that I want to get rid of. This is a very special laser. Most lasers fire forward. This is a side firing laser. So when I aim it down, it's going to melt fat and it's going to tighten the fibrous tissue that helps give that lift and give that nice angle. When I aim it up, it's going to tighten the skin. And then when I'm done with the laser, I take the laser out and I put in a suction cannula to remove all of that melted fat. But in addition to melting fat and tightening the fibrous tissue and tightening the skin, The heat from the laser does something else that's really important. It stimulates fibroblasts to make collagen. So over the next 3 to 6 months, there's a thickening of the skin. Studies have shown that over 3 months, there's a 29% thickening of the skin of the neck. So the skin actually improves. So how does Precision TX compare to other procedures? Well, it's more precise, more direct, and more efficient than previous lasers. And compared to other procedures that are out there now, it's safer because the probe that measures the temperature is at the tip of the laser, whereas the other procedures that are out now have a temperature probe at the surface of the skin, but the laser is underneath the surface of the skin. So you're not actually measuring the heat where the heat is being delivered. And that's not as safe as measuring the heat where the heat is being delivered, because the Precision TX turns off if the heat is getting too high. So who are the best candidates? The best candidates are people who have mild to moderate double chin, mild to moderate excess fat on their neck, or mild to moderate sagging along the jawline. The ideal time to do it is in the fall or winter, because after the procedure, I have you wear a garment for 4 days afterwards, and then at night for 2 additional weeks. And that's because, remember, I separated the skin from the underlying tissue to do the procedure, but now we want the skin to heal to that underlying tissue. And so that's what that garment does. It holds it. It's like an ACE wrap. And so we want it to hold it there so that it heals really nicely. And it's nicer to do that during cool weather. If you go to our website, you will see some really excellent pictures of our own patients who've had Precision TX done. If you have any questions, please comment below. As you know, I love that interaction. And I look forward to talking to you again next week. Stay well.